I lay in that hospital bed, unable to move anything except my eyes, while my mother held my hand and whispered, "It's okay, Marcus. You can let go now. You fought long enough." My family had gathered around me to say goodbye to watch me die from pneumonia they decided wasn't worth fighting. But then Dr. Rachel Kim walked into the room, looked at my face, looked at the monitors, and said 6 words that changed everything. "I don't think he wants this." And suddenly, the peaceful death my family had planned became a fight for my right to choose whether I lived or died. My name is Marcus Chen. I'm 19 years old, and I've had severe cerebral palsy since birth. I can't walk, can't talk, can't control most of my muscles, but I can think. I can understand everything. I can feel everything. My family knows this, at least. They used to know this. But somewhere over 19 years of caring for me, of doctor's appointments and therapies and modified equipment, they stopped seeing me as a person who has opinions and started seeing me as a burden they loved, but were exhausted by. I communicate through eye gaze technology, a computer that tracks where I look on a screen, letting me type words letter by letter. It's slow. A simple sentence takes minutes. Most people don't have the patience to wait. So over the years, my family stopped asking and started deciding for me. I've always been aware of being different. Even as a kid, I knew my parents looked at me with love mixed with grief, love for who I was, grief for who I'd never be. My brother David was the golden child. Smart, athletic, everything easy for him. He talked to me sometimes, but mostly he was embarrassed. At his high school graduation, he asked if I could stay home. "It's just easier, Mom. People stare." My sister Jessica was kinder, but distant. She chose medicine, and I used to think it was because of me. But as she got older, I realized she wanted to fix people, and I was unfixable. I communicate through eye gaze technology tracking, where I look to type letters. It's slow. People don't wait. "What do you want for dinner, Marcus?" My mom would ask, then answer for me before I could type. "I think pasta sounds good, doesn't it?" They meant well. But they stopped asking and waiting for answers years ago. 2 months ago, something amazing happened. I was accepted into a program at the University of Washington, a disability studies program designed for people with severe physical disabilities. I'd worked for a year on the application, typing with my eyes, writing an essay about what it meant to exist in a body society, deemed broken. I got in. Full scholarship. Adaptive technology, support services. When the acceptance letter came, I used my computer to type, "I got in. I'm going to college." My mother read it and burst into tears. "Oh, Marcus. Honey, I don't think that's realistic, but I got accepted," I typed. "I know, sweetheart, and we're so proud. But living independently, managing your care needs, it's too much. I want to try." My father joined in. "Marcus, you need round-the-clock care. Who's going to help you eat, use the bathroom, get dressed? We can't move to Seattle with you. The program has support." "It's not enough," my mother said firmly. "We have to be realistic about your limitations, my limitations. Not the system's, not society's. Mine." Jessica supported them. "Marcus, I'm a medical resident. I see CP patients. The level of care you need, it's not something a university program can provide. Mom and Dad are right. 3 against 1. And the one couldn't even argue without typing for 5 minutes to complete a thought. I stopped using my computer as much. What was the point? No one listened anyway. Then 3 weeks ago I got sick. Started with a cold, progressed to pneumonia. My lungs have always been weak, common with CP. Usually we catch it early, antibiotics work, I recover. This time was different. It hit hard and fast. Within days, I was in the ICU on a ventilator, fighting for every breath. The first few days my family was terrified. Vigil by my bedside, praying, hoping. But by day 5, when I wasn't improving quickly, the conversation changed. "How long can this go on?" my father asked the doctor. "It's hard to say. Pneumonia in CP patients can be prolonged. And if he doesn't improve?" We discuss options. Options. The word hung in the air like a threat. By day 7, my mother was researching hospice care. "For when the time comes," she told my father, not knowing I could hear everything. "Is it time?" my father asked quietly. "He's been fighting for 19 years. Maybe this is the universe telling us it's okay to let him rest. Let him rest. Let me rest." Like I was a tired child, not a person fighting for my life. By day 10, they'd made their decision. "We need to talk to the doctors about DNR, my mother told Jessica. "Do not resuscitate. If my heart stopped, they wouldn't try to bring me back. Are you sure?" Jessica asked, her voice uncertain. "Look at him," my mother said. I could see her from my bed, her face tired and sad. "He's suffering. He's been suffering his whole life. Maybe it's time to let him go peacefully." I wanted to scream. "I don't want to go. I'm not ready. I'm 19. But I was on a ventilator, sedated. My eye gaze computer wasn't set up in the ICU. I had no voice. No way to object. No way to fight." Day 12. My family gathered in my ICU room with the medical team to discuss the plan. The attending physician was Dr. Patterson, 60-something, kind but clinical. "Marcus isn't improving as quickly as we'd hoped. The pneumonia is persistent. We could continue aggressive treatment, But given his baseline condition and quality of life considerations, we could also transition to comfort care. Comfort care. Another euphemism for letting me die. What would comfort care look like? My father asked. We'd remove the ventilator, keep him comfortable with medication, allow natural passing. Usually within hours to days. Would he suffer? My mother asked. We'd make sure he's comfortable. He wouldn't feel pain. I wouldn't feel pain because I'd be dead. My mother looked at my father. My father looked at Jessica. They were all crying. I think it's time, my mother said. He's tired. We're tired. It's been 19 years of fighting. Maybe it's okay to stop. No one asked me. We'd like to proceed with comfort care, my father told Dr. Patterson. Let him go peacefully. Dr. Patterson nodded sympathetically. I'll write the orders. We'll schedule for tomorrow morning. That gives you time to say goodbye. Tomorrow morning, I would die tomorrow morning. And I didn't get a vote. The family left to call relatives, to plan. To grieve for the son and brother they decided to let die. I lay there, screaming inside a body that wouldn't cooperate, terror flooding every cell. That night, a different doctor walked in, not Dr. Patterson. A woman, maybe late 30s, Korean American, her badge read, Dr. Rachel Kim, intensivist. She approached my bed, looked at my chart, looked at the monitors, then looked at my face. Really looked. Not the glazed-over look of someone seeing a body, but the focused look of someone seeing a person. She pulled up a chair, sat at eye level with me. Hi Marcus, I'm Dr. Kim. I'm covering the ICU tonight. She paused. I reviewed your chart. I saw the comfort care order scheduled for tomorrow. I tried to make my eyes show something. Anything. She leaned closer. Can you hear me? Can you understand me? I moved my eyes deliberately. Up, then down. The only movement I could control reliably. Is that yes? Up and down for yes? I did it again, frantically. Okay, eyes up and down for yes. Side to side for no. Can you do that? Side to side, yes. She pulled out her phone, opened a notes app with large letters. I'm going to point to letters. You look at the one you want. We'll spell out words. It'll be slow, but we'll get there, okay? Up and down. Yes. Desperately, gratefully, yes. Dr. Kim held up her phone, pointing to letters one by one. I'd look at the one I wanted. She'd write it down. Letter by letter, agonizingly slow, I spelled D-O-N-T-L-E-T, M-D-I-E. Her face went pale. You don't want the comfort care? Up and down. Up and down. Nitrogen monoxide. Does your family know you don't want this? Side to side. No. Have they asked you? Side to side. No. She sat back, processing. Then she stood up, determination on her face. Marcus, this is important. Are you saying you want us to continue treatment? To fight the pneumonia? Up and down. Yes. 1,000 times yes. Even if it's hard? Even if recovery is long? Yes. She pulled out her phone. I'm calling ethics. And I'm calling my attending. This decision isn't happening tomorrow. She left the room. I heard her in the hallway, voice firm and clear. I have a patient scheduled for comfort care tomorrow morning. 19 years old, cerebral palsy, nonverbal, but he's communicating. And he's saying he doesn't want to die. His family hasn't asked him. We need ethics consultation here tonight. 20 minutes later, my room filled with people. Dr. Kim, Dr. Patterson, a woman from the ethics committee, a patient advocate, and my family confused, defensive, afraid. What's going on? My mother asked. We agreed to comfort care. Why are we being called back? Dr. Kim spoke calmly but firmly. Mrs. Chen, when was the last time you asked Marcus what he wants? Asked him? He can't speak. He can communicate, with his eyes. I spent 30 minutes with him. He's cognitively intact. He understands everything. And he's been telling me very clearly that he doesn't want to die. The room went silent. That's not possible, my father said. Marcus doesn't have the capacity to make medical decisions. He has complete capacity, Dr. Kim interrupted. He has cerebral palsy, which affects his motor function. It doesn't affect his cognition. He's been listening to every conversation you've had about letting him go. And he's been screaming inside that he doesn't want that. My mother looked at me, really looked at me, for the first time in days. Marcus? Is that true? Dr. Kim held up her phone with the letters visible. Ask him yourself. Point to letters. He'll look at what he wants to say. My mother, hands shaking, held up the phone. Started pointing to letters. Marcus, she said, voice breaking. Do you want us to keep fighting? To keep treating the pneumonia? I looked at the letters. Y-E-S. Even if it's hard? Even if recovery takes weeks? Y-E-S. She started crying. Oh my God, Marcus, I'm so sorry. We thought we were helping you. We thought you were tired of fighting. We thought you were suffering and wanted peace. I spelled out slowly. Un-ot, ria d-y-o ant o-live. My father collapsed into a chair, his face in his hands. We almost killed him. We almost killed our son because we didn't bother to ask him. Jessica was crying too. Marcus, I'm so sorry. I'm a doctor. I should have known better. I should have insisted we find a way to communicate with you before making this decision. the ethics committee member, spoke up. Mr. and Mrs. Chen, legally you have guardianship over Marcus. But guardianship doesn't mean you make decisions for your son. It means you make decisions with him, considering his wishes. If Marcus is clearly communicating that he wants treatment, we have an ethical and legal obligation to honor that. Of course, my father said quickly. Of course we want what he wants. We just thought. We assumed ... double quotes he couldn't finish. Dr. Patterson looked uncomfortable. I should have insisted on a communication assessment before agreeing to comfort care orders. That was my failure. Dr. Kim shook her head. It's a system failure. We see someone who can't speak and we assume they can't communicate. We assume family knows what they want. We don't take the time to actually find out. She looked at my family. Marcus told me something else. He said he was accepted to University of Washington. A disability studies program. Is that true? My mother nodded, shame crossing her face. Yes, but we told him it wasn't realistic. That he couldn't handle it. Did you ask him if he wanted to try? Or did you just decide for him? Silence. Dr. Kim's voice was gentle but firm. He's 19 years old, legally an adult. He has the right to make his own choices, even if those choices are hard. Even if they require support. Even if they scare you, she turned to me. Marcus, do you still want to go to college? Even knowing it'll be difficult? Yes. Do you want to try living more independently with support services? Yes. Even if it means your parents can't control every aspect of your care anymore? Yes. 1,000 times, yes, my mother was sobbing now. We've been so focused on taking care of you, on protecting you, that we forgot you're not a child anymore. You're a person with your own dreams, your own wants. And we've been crushing those dreams because we thought we knew what was best. David spoke for the first time, his voice thick. I told you to stay home for my graduation. I was embarrassed by my own brother. God, Marcus, I'm so sorry. The patient advocate leaned forward. Marcus, would you like help enrolling in that university program? We have social workers who specialize in helping disabled adults transition to independent living. Yes. It won't be easy, she warned. You'll need to arrange your own care team, manage your own schedule, advocate for yourself. It's a lot of responsibility, I spelled out carefully. I can know W. I win TTOTRY. 3 weeks later, I was out of the ICU. The pneumonia was clearing. I was breathing on my own again. Getting stronger every day. Dr. Kim visited me before I was discharged. You're going to be okay, Marcus. The pneumonia's gone. Your lungs are healing. You're strong. I used my eye gaze computer. They finally set it up in my regular room. Thank you for seeing me. Thank you for fighting, she said. You taught me something important. I've been a doctor for 15 years, and that probably made assumptions about disabled patients' quality of life without really asking them what they wanted. You reminded me that just because someone can't speak doesn't mean they have nothing to say. 2 months after that, I moved into the University of Washington's disability housing. It was terrifying. I had a team of caregivers who helped with my physical needs, but I made my own schedule, chose my own classes, decided how to spend my time. My first week, I used my computer to join an online disability advocacy group. Met other people like me, people who'd been underestimated, overlooked, assumed to want death rather than a difficult life. One guy, also with CP, typed to me, "People think we want to die because living like this is hard. But life is hard for everyone. We just want the same chance everyone else gets to try, to fail, to succeed, to try again. To live." My parents visited every weekend. They were really trying to see me as an adult, not a perpetual child who needed protection. We're sorry, my mother said on one visit. We spent 19 years so focused on what you couldn't do that we never asked what you wanted to do. David came once, actually sat and waited while I typed responses. You're braver than I'll ever be, he said. I'm proud to be your brother. Jessica came most often. You changed how I practice medicine, she told me. Now I ask, always, even when it's slow, even when it's hard, I ask patients what they want. Because of you. My name is Marcus Chen. I'm 19 years old. I have severe cerebral palsy, and my family people who loved me deeply decided to let me die because they thought that's what I do want. They thought my life was too hard to be worth living. They thought 19 years of fighting was enough. But they never asked me. Dr. Rachel Kim did. She looked at my face and saw terror instead of peace. She took 30 minutes to communicate with me when everyone else had given up. She asked the question no one else thought to ask, what do you want? And I told her I want to live. I want to go to college. I want to try. Life is hard. Managing my care, keeping up with schoolwork, living away from home, it's exhausting. Some days I wonder if my family was right, if it would be easier to just give up. But then I remember, easy isn't the point. Living is the point. Having choices is the point. Being seen as a person with dreams and rights and autonomy, that's the point. I almost died because my family loved me so much they couldn't see me anymore. They saw my disabilities, my care needs, my limitations. They didn't see me Marcus, the person who wanted to go to college, who had dreams, who had the right to choose his own life, even if that life is difficult. Dr. Kim saw me, and she refused to let me disappear without a fight. I'm alive because one doctor took the time to ask. And now I'm living because I finally have the chance to answer.